Next on our special show on seniors, we have Dr. Jeffrey Mariano. He is a geriatrician with Kaiser Permanente. Thank you, doctor, for joining us today. I really want to really feature the fact that there are specialists in the area of treating older adults,
yes.
right?
Yes.
So tell me more about what you do with Kaiser.
Well, thank you for this opportunity. I'm actually the Assistant Chief of the Geriatrics and Palliative Care Program at Kaiser West LA. We're involved in multiple programs that care for older adults in a variety of settings, including the home and the clinic, and some hospital-based care as well. And also I'm involved in training for geriatric fellows that are additional physicians that are getting additional training at Kaiser.
So tell me what that means to be a geriatrician.
So geriatrics is that field of medicine that actually comes after training either in internal medicine or family medicine. Its focus is primarily on the diseases and management of aging in all its forms, with a focus on functional status, quality of life, decisions, and again, the issue that many older adults face is a coming together of multiple conditions, and that including things like dementia, which can complicate medical care.
Absolutely.
Yeah.
Share with me what you see as normal aging versus what is not, things that we can kind of avoid.
Yeah. So normal aging, we do know that as we get older, more and more of our different organ systems get used, but normal aging really manifests itself in a variety of ways. For example, many people who have problems with memory fear dementia, for example. But dementia is really when memory and other cognitive problems become so severe that it affects one's functioning. There's normal memory aging changes, like having problems with multitasking, which is very normal. Having problems maybe with that tip of the tongue phenomenon, but then you get the name later on.
Can't think of the word.
Can't think of the word. So those are actually normal.
The senior moments.
The senior moments. And there's a lot of things that we do know in medicine, actually, that we can be proactive about to prevent, for example, memory changes, like exercise, we know.
Yes.
Smoking, addressing hypertension and cholesterol. These are the things that your doctor would help you, and we know actually have found to prevent memory loss as well as prevent actually the development of dementia.
And cancers and
amazing. And cancer screening is very important.
Diabetes must be a big one that you see pretty frequently that can somewhat be avoided, right?
Yes, and again, a lot of things can be done, and that allows for aging to be more normal, actually.
And happy, right?
And happy.
Improve quality of life.
Yes.
So I think the other thing that's interesting about the Kaiser system, which is kind of what everybody else is getting on the bandwagon with, is creating a system that creates that continuity of care, like from the beginning of end to services, whether that's just from the doctor's office to getting rehab to going back home. And you have your own little system within that, correct?
Yeah, that's very true. It is an integrated system, and it is something that, because of how important it is to get a continuity of care, a lot of health systems are responding to. And the other thing too is, even before, for example, getting sick, there's definitely a focus on preventative medicine.
Sure.
So even taking classes on weight loss and stress reduction and sleep.
They are big on that, right?
Those are all really important, because that can, shore up the reserves you have and allow you to age better.
Yeah, I know. I also think about end of life too, and how we really avoid those issues and talking about things that are really tough and it's depressing and scary, and people don't like to have to deal with those things. You mentioned palliative care. Can you describe palliative care and how you might talk about a patient with that?
Well, I think palliative care is one of that branches of medicine also that focuses on communication and clarifying values and goals. Because any disease that you get diagnosed with has a progression. And sometimes that progression can reach to a point where quality of life becomes compromised. And the more you talk about what's important for you, the more you can give a gift to your family about saying, hey, if we reach this point, I don't want that type of care. And palliative medicine also focuses on symptom management as well in conditions like cancer, but even things like heart failure and kidney disease, those two can be co-managed with other doctors as well. And that's what palliative medicine is.
Nice. Dr. Mariano, thank you very much for joining us. Any closing phrase that you would like to share with us?
Well, I think aside from the preventative things we talked about that your doctor can help with, I think one of the most important things is maintaining social connection.
Yes,
that's
very
critical,
important.
So that when you use it so you don't lose it, so that means staying active and staying connected.
And friends can mean a lot. Right?
Yes. Yes.
Great. Thank you so much.
Thank you.
Up next, the dangers a senior may face with the wrong caregiver in the house. Shane Hall will share with us how to find the right caregiver. Up next.